Deputy Majority Leader and Vice Chair Jose Bong Teves Jr., Vice Chair Loreto Amante, Representative Maria Cristina Angeles, Representative Alexander T. Pimentel, and Vice Chair Jerry Boy Espina, and Vice Chair Romeo Momo, Sr. And for the Philippine Charity Sweepstakes Office, may we acknowledge the presence of the chairpersons, Judge Felix Reyes. Good afternoon, sir. General Manager Melquiades Robles. Assistant General Manager Attorney Liza Grace Pagano. Good afternoon, ma'am. Assistant General Manager Attorney Lauro Patiag. Assistant General Manager Remeliza Gabuyo. Assistant General Manager Julieta Aseo. Are you here, ma'am? Assistant General Manager Arnett Casas. And Attorney Annalisa Insyong. That's all, Madam Chair. Mr. Chairman.
Thank you, COMSEC. Former President Representative Gloria Macapagal Arroyo, Senior Deputy Speaker Ferdinand Fernandez, to our dear colleagues, welcome to the budget briefing of the Philippine Charity Sweepstakes Office. I would like to extend my warm welcome to the hardworking officials of the PCSO who are joining us today, headed by Chairperson Judge Felix P. Reyes, sir, General Manager Mel Robles, at sa buong pamilya po ng PCSO. Welcome to the House of the People. As well as our esteemed colleagues, magandang hapon po sa ating lahat. The PCSO is one of the unique agencies appearing before us. It generates its own revenues and redistributes the vast majority back to the public. In the past year alone, the agency generated nearly 65 billion through its games and activities, with significant portion directed to medical assistance, hospitalization support, and essential healthcare transport. Our objective this afternoon is to know how its available resources can effectively reach their intended beneficiaries. From 2024 through the first half of this year, PCSO reports providing approximately 8.1 billion in medical assistance to over 681,000 patients, with a projected 20 billion charity fund for fiscal year 2027. Our responsibility today is to verify that these substantial figures deliver tangible and equitable public benefits. So let's keep the discussion straightforward as what needs to be asked, and let's give PCSO a fair hearing. May I now call on the PCSO to begin their presentation.
Good afternoon,
yes, Mr.
members
Chair.
of the Committee on Appropriation. May I first be allowed to give the opening statement for our agency?
Yes, please go ahead, Chair.
On behalf of the Philippine Charity Sweepstakes Office, I would like to express our sincere appreciation to the Committee on Appropriation, headed by its chairperson, Honorable Congresswoman Micaela Swansing, and of course, the Senior Vice Chairperson, Honorable Albert S. Garcia, for giving us the opportunity to present the PCSO's proposed budget and programs for the coming fiscal year. We are honored to appear before this committee and to share not only our budget requirements, but more importantly, how we intend to translate these resources into meaningful and tangible benefits for the Filipino people. The PCSO remains firmly committed to fulfilling its mandate under Republic Act number 1169 as amended, to generate and provide funds for health programs, medical assistance and services, and charitable activities of national character. Every peso entrusted to PCSO carries with it a responsibility to serve. Our budget, therefore, is not simply a financial plan. It is an instrument for expanding access to healthcare, strengthening our assistance program, bringing essential services closer to communities and ensuring that our operations remain efficient, accountable, and responsive. PCSO continues to strengthen its financial performance, governance, responsible gaming initiatives, and delivery of charitable services. We recognize, however, that the needs of our people continue to grow. This makes prudent resource allocation, operational efficiency, and sustained support for our programs even more critical. Today, we respectfully present our proposed budget, our priorities, and the outcomes we seek to achieve. We assure the committee that we will continue to exercise the highest standards of fiscal responsibility, transparency, accountability, and good governance in the use of public resources. We look forward to the guidance and support of the committee as we work together toward a budget that will enable PCSO to reach more beneficiaries and create greater impact for the Filipino people. Once again, our deepest appreciation to the distinguished members of the Committee on Appropriation. Thank you very much and good afternoon. And for our report, may I give the floor to Attorney Lisa Insyong.
Okay. Attorney Lisa, please proceed. Thank you very much, Chairman, for your presentation.
Good afternoon, Honorable Albert Garcia, Senior Vice Chair, and honorable members of the House Committee on Appropriations. We begin this briefing by recalling the mandate that guides the work of the Philippine Charity Sweepstakes Office. The Philippine Charity Sweepstakes Office is the principal government agency for raising and providing funds for health programs, medical assistance and services, and charities of national character through the holding and conduct of sweepstakes, horse races, lotteries, and similar activities. This mandate is at the heart of every peso that PCSO generates and every peso that we allocate. Our financial performance is therefore not only about revenues, expenditures, and targets. It is ultimately about our capacity to provide meaningful assistance to the Filipino people. Let us now proceed to the budgetary highlights and major thrusts, including plans, programs, and strategies to be undertaken by the PCSO in 2027. First is the distribution of landing craft vessels, or LCVs, to coastal provinces and provinces with coastal municipalities. This initiative aims to address the unique challenges faced by geographically isolated and coastal communities, particularly in accessing healthcare and emergency services. Second, the donation of medical equipment and to beneficiary entities. This is intended to strengthen the capacity of hospitals and healthcare facilities by providing much-needed equipment. The desired impact is improved healthcare, better patient care, and greater access to essential medical services. Third, PCSO's participation in the government initiative to establish a radiation oncology center. This initiative seeks to improve access to cancer diagnosis, treatment, and specialized care while helping reduce the financial and health burdens of cancer on Filipino families. Fourth, increasing PCSO revenues through the development of new games and betting platforms. This is critical to sustaining PCSO's capacity to fund its various health and charitable programs. By responsibly expanding our revenue-generating activities and responding to changing consumer preferences, we aim to increase the resources available for medical assistance, health programs, and other charitable initiatives. Finally, strengthen public service delivery through digitalized processes and the successful transfer of operations to the PCSO Corporate Center in San Marcelino, Manila. Digitalization is intended to make our services more accessible, efficient, transparent, and responsive. At the same time, the successful transfer to the corporate center will provide a more integrated and efficient working environment for our operations. Next slide, please. For our operational highlights from 2024 to 2026, first, the Medical Assistance Program remains one of PCSO's most significant and direct expressions of its mandate to provide meaningful medical assistance to Filipinos in need. From 2024 to the first semester of 2026, PCSO provided 8.13 billion in assistance to 681,099 beneficiaries. In 2024, PCSO assisted 326,482 beneficiaries with 3.24 billion. In 2025, despite a 28% decline in beneficiaries to 236,217, assistance slightly increased to 3.25 billion. This translates to a substantial increase in average assistance per beneficiary, reflecting PCSO's focus on greater efficacy and efficiency. The focus is not merely on the number of beneficiaries served, but on maximizing the impact of every peso allocated to medical assistance. This is particularly significant given PCSO's continuing contribution to government's health agenda, including its increased remittance to the Universal Healthcare Program. Despite this higher financial obligation to broader national health system, PCSO continues to provide substantial direct assistance to patients and their families. Moreover, pursuant to the expressed desire of the members of the House Committee on Appropriations, PCSO has expanded its financial assistance to include professional fees for qualified patients. This makes the assistance more comprehensive, responsive, and patient-centered, helping families meet the full cost of necessary medical care. Next, the Institutional Partnership Program shows a positive trend, with beneficiaries doubling from 19 in 2024 to 38 in 2025, accompanied by an increase in assistance from 12 million to 24.6 million. By the first semester of 2026, another 19 beneficiaries had already been assisted. A particularly strong growth is seen in the Medical Transport Vehicle Donation Program. Beneficiaries increased from 431 in 2024 to 1,090 in 2025, while assistance increased from 913.7 million to 2.48 billion. This reflects PCSO's intensified efforts to bring emergency and medical transport services closer to communities. As of July 31, 2026, PCSO has distributed 154 PTVs to complete the 100% distribution of PTVs in provinces, cities, and municipalities. The Medical Equipment Donation Program, on the other hand, shows increased assistance funding from 20.5 million in 2024 to 22 million in 2025 and already reached 154.58 million in the first semester of 2026, indicating a significant acceleration in equipment support. Meanwhile, the outpatient services and multi-specialty clinic continues to expand its reach, with beneficiaries increasing from 7,383 in 2024 to 9,416 in 2025, and another 8,440 beneficiaries already served in the first half of 2026. For the financial highlights for 2024 to the first semester of 2026, PCSO's total revenues from its major games increased by 4.02%, from 62.35 billion in 2024 to 64.86 billion in 2025. The growth was primarily driven by STL, which increased by 11.99%, and the National Instant Sweepstakes Program, which grew by 20%. For the first semester of 2026, PCSO generated 32.68 billion. Overall, the revenue trend remains positive and resilient, with SCL serving as the main growth driver. The next slide reflects the comparative gross sales for the first semester of 2024 to the first semester of 2026. The graph shows a consistent upward trend in PCSO revenues for the first semester of 2024 to 2026. Revenue increased from 30.98 billion in the first semester of 2024 to 31.89 billion in 2025, or 2.94% growth. This further increased to 32.68 billion in the first semester of 2026, representing another 2.48% increase. Overall, first semester revenues grew by approximately 5.49 from 2024 to 2026. The next slide shows comparative financial statements for 2024, 2025, and the first semester of 2026. The financial data show the total income increased by 3.86% from 63.42 billion in 2024 to 65.87 billion in 2025, indicating continued growth in revenues. However, operating expenses increased by 5.59% from 51.01 billion to 53.86 billion. As a result, profit after tax slightly declined by 1.88% from 11.74 billion to 11.52 billion. Financial assistance, subsidies, and contributions increased significantly by 20.84% from 7.89 billion to 9.54 billion, reflecting the continued commitment to PCSO's charitable mandate. This contributed to the decline in the net income, which decreased by 48.57% from 3.84 billion in 2024 to 1.98 billion in 2025. As of June 30, 2026, PCSO already recorded 31.74 billion in total income and 3.35 billion in net income. The next slide illustrates the comparative financial statements for 2025 and the first semester of 2026. For the first semester of 2026, total income slightly decreased by 1.95% from 32.38 billion to 31.714 billion. However, total expenses decreased by 6.95% from 25.15 billion to 23.40 billion. As a result, profit after tax increased by 15.03% from 6.32 billion to 7.27 billion. PCSO also provided 3.92 billion in financial assistance, subsidies, and contributions, an increase of 16.89%. Overall, net income increased by 12.94% from 2.97 billion in 2025 to 3.35 billion in 2026. For the next slide, we have the distribution of PCSO revenue allocation for years 2023, 2024, 2025, and estimates for 2026 and 2027. For 2023, PCSO recorded 61.46 billion in retail receipts from Lotto, STL, and NISP. Of the net receipts, 55% or 33.22 billion was allocated to the prize fund, 30% or 18.11% to the charity fund, and 15% or 9.05 billion to the operating fund. For 2024, PCSO recorded 62.35 billion in retail receipts from Lotto, STL, and NISP. After deducting 1.06 billion in printing costs, total net receipts amounted to 61.30 billion. Of the net receipts, 55% or 33.71 billion was allocated to the prize fund, 30% or 18.39 billion to the charity fund, and 15% or 9.19 billion to the operating fund. overall net receipts increased by about 1.56% from 2023, reflecting a modest improvement in total sales and available funds. For 2025, PCSO recorded 64.86 billion in retail receipts from Lotto, STL, and NISP. After deducting 1.09 in printing cost, total net receipts amounted to 63.77 billion. Of the net receipts, 55% or 35.07 billion went to the prize fund, 30% or 19.13 billion to the charity fund, and 15% or 9.57 billion to the operating fund. The next slide is the revenue allocation estimates for 2026. For 2026, total estimated retail receipts are 67.26 billion from Lotto, STL, and NISP. After deducting the estimated 1.35 billion for printing cost, total net receipts are projected at 65.91 billion. Following the prescribed allocation, 55% or 36.25 billion is estimated for the prize fund, 30% or 19.77 billion for the charity fund, and 15% or 9.89 billion for the operating fund. The next slide is the revenue allocation estimates for 2027. For 2027, total estimated retail receipts are 68.55 billion from Lotto, STL, and NISP. After deducting the estimated 1.37 billion for printing costs, total net receipts are projected at 67.18 billion, representing an increase of about 1.93% from the 2026 estimate. Based on the prescribed allocation, 55% or 39.95 billion is estimated for the prize fund, 30% or 20.15 billion for the charity fund, and 15% or 10.08 billion for the operating fund. We now proceed to the significant accomplishments of PCSO for the year 2025 and the first semester of 2026, highlighting actual performance against planned targets. This covers 5 key areas: gross revenues, PTV distribution, medical assistance, institutional partnerships, and WLA certification. First, on gross revenues, in 2025, PCSO targeted 68.64 billion and achieved 64.86 billion, or 94.5% of the target. The shortfall was largely due to opportunity losses arising from several calamities and weather disturbances throughout 2025, which affected gaming operations and revenue-generating activities. Second, for PTV distribution, PCSO significantly exceeded its 2025 target of 500 patient transport vehicles, distributing 1,090 PTVs, or 218% of target. For 2026, against a target of 258 PTVs, 154 PTVs have already been distributed as of July 31, 2026. Third, for the medical assistance program, PCSO targeted 3.302 billion in 2025 and released 3.245 billion, benefiting 236,217 patients, or approximately 98.3% of the annual financial target. The slight shortfall reflects the timing and actual utilization of assistance during the year. For 2026, PCSO has allocated 3.65 billion for the medical assistance program. As of June 30, 2026, 1.64 billion has already been released, benefiting 118,400 patients. For the institutional partnership program, PCSO exceeded its 2025 target of 30 partner agencies by establishing partnerships with 38 agencies. For 2026, 19 partner agencies have already been established against the annual target of 30, representing 63% of the target as of the reporting period. Finally, for the World Lottery Association certifications, PCSO successfully attained World Lottery Association Level 3 Responsible Gaming Certification in 2025, exceeding its target of obtaining Level 3 certification. Responsible gaming ensures that revenue generation is pursued in a manner that is ethical, sustainable, and socially responsible. For 2026, PCSO is pursuing World Lottery Association Security Control Standard 2024 Level 1 certification, which focuses on strengthening the security and integrity of the corporation system, information, critical operations, and security controls. We now move on to the other significant accomplishments of PCSO for 2025 and 2026. First is a 100% distribution of patient transport vehicles to provinces, cities, and municipalities. Second is the donation of portable, AI-capable X-ray machines and various medical equipment to beneficiary entities amounting to 176 million, and the distribution of Charitimba mobility aids, assistive devices, rescue devices, and evacuation kits to various LGUs amounting to 348.6 million under the Corporate Social Responsibility Program. We now go to the status of PCSO's remittances under the Universal Healthcare Program covering 2025 to the first semester of 2026. For 2025, PCSO remitted a total amount of approximately 2.57 billion. For 2026, covering the first two quarters, first quarter is 651.47 million, and second quarter is 690.67 million. Combining 2025 remittances and the first semester of 2026, the total among due and remitted is 3.914 billion pesos. It is important to highlight that the amount due and the amount remitted are exactly the same for each period, indicating 100% remittance of the amounts reflected in the table. For the next slide, we present PCSO's contribution to the National Treasury through taxes, dividends, and other remittances covering the period 2021 to the first semester of 2026. This table shows PCSO's contributions to the National Treasury through taxes, dividends, and mandatory contributions from 2021 to 2025, with the first semester of 2026 also reflected. For the last full 5 years, 2021 to 25, PCSO contributed a total of approximately 101.29 billion to the national government. Taxes accounted for the largest share at 79.04 billion, followed by dividends of 9.93 billion and universal healthcare contributions of 9.53 billion. Overall, PCSO's total contributions increased from 14.56 billion in 2021 to 21.85 billion in 2025, representing a 50.1% increase. As of June 30, 2026, PCSO has already remitted an additional 11.06 billion, bringing the total contributions reflected in the table to 112.35 billion. These figures demonstrate PCSO's significant and sustained contribution to government revenues, healthcare, and national programs. In closing, our report demonstrates PCSO's continued financial resilience, operating performance, and commitment to its charitable mandate. Despite changing economic conditions, PCSO continues to generate revenues, provide support for the health and welfare of the Filipino people, and contribute significantly to the national government. Sa bawat taya, may kawang gawa, and that is the greater purpose of PCSO, to transform hope into help, to turn revenues into meaningful assistance, and to ensure that the benefits of charity reach those who need them most. PCSO, hindi umuurong sa pagtulong. Maraming salamat.
Okay, thank you very much, Attorney Ana Lisa Inchong, for your presentation. Dear colleagues, before we begin, may I remind our distinguished colleagues that each member is given 5 minutes for questioning or interpellation, excluding the response of the resource person. And when you hear the bell sound, it means, yan po yung bell. Pag narinig nyo po yan, it means you only have 30 seconds to wind up with your questions. As part of a long-standing and respected tradition of the House of Representatives to accord preferential treatment to the minority member of the House and followed by the independent and the majority member in an alternating manner. The chair now recognizes from the majority, dahil wala pa yung minority.
Chair from the minority.
Ay, sorry. Dito na pala si Congresswoman Montes. Sorry, hindi ko na... nagpalista ba kayo? Ayun. Okay, thank you. Thank you for correcting me, Representative Montes. So following our time-honored tradition, I now recognize Congresswoman Montes for
Thank you
her
very much,
interpellation.
Mr. Chair. Ang katanungan ko po tungkol sa UHC, no? RA 11223 or the Universal Healthcare Act was enacted on Feb 20, 2019. And one of the provisions said that 1 year following its enactment, kailangan pong mag-remit ng PCSO yung nakatalaga doon na provision that 40% of its net charity fund be given to the PhilHealth para sa UHC. Ano po? Ang tanong ko po, kailan po nag-umpisang mag-remit ang PCSO sa Bureau of Treasury? Anong taon po inumpisahan?
Our remittances to the PhilHealth at National Treasury or the UHC started way back in 2022.
Tama po ba ang figure? So you started in 2022 with 2.71 billion, 2023 2 billion, 2024 2.13, 2025 2.87, and 2 quarters first half of 2026 194 based sa presentation po kasi 25 and 26. Tama lang. Tama po.
Yes,
Okay.
yes,
Okay
Your
po.
Honor.
Tanong ko lang po, were these remittances made on time? Meaning, as per the provision of the law, it has to be quarterly ang remittance.
Yes, we are doing it on time, quarterly. And for the last time, our GM even personally delivered it to the National Treasury.
There were never an instance that it was delayed, Mr. Chair?
None that we remember, Your Honor.
Okay. Doon po sa I understand, noong July 16, parang nag-turnover po kayo among other contributions of PCSO to the national government. Nag-turnover po kayo sa Bureau of Treasury. Yung tinurnover nyo na 1.935 billion covers mandatory contributions from fourth quarter 2025 through first quarter and second quarter 2026. So, tama po ba na yung dapat iniremit nyo ng January na fourth quarter na i-turn over ng July?
Yes, yes, Your Honor.
Yeah, that's why I asked
that's the
if
corresponding
there were
amount.
instances na di-delay po because we have a problem. I don't think nare-remit niyo po on your part, nare-remit niyo po sa National Treasury.
Yes, Your Honor.
Pero po hindi na ibibigay sa PhilHealth on time. I have yet to find out from the DBM and the DOF kung timely na kasi from the last time na I took the floor during the budget hearing last year, since the law's enactment, nising ko po from your share and from Pagcor share, wala pong naibigay sa PhilHealth. That's why I'm trying to consolidate all data coming from the funding streams of PhilHealth to find out later on kung ano ang nagiging problema, kung yung remittance ninyo po ba ay naibibigay na sa PhilHealth. Because as of last time, wala pa po na remittance ninyo kahit 5 ang nakarating sa PhilHealth. Ano po? But I understand, nagre-remit po kayo sa Bureau of Treasury.
Yes, Your Honor.
Okay po. Siguro yun lamang po for now. Mr. Chair, may I just request the PCSO to officially submit to this committee their remittance to the Bureau of Treasury regarding the 40% net charity fund share to PhilHealth as provided for in RA 11223. Para po later on, magtutugma sa data na hihigin ko naman po sa DOF or sa DBM. If you can please submit it at the soonest possible time, I will highly appreciate.
Yes, Mr. Chairman, Your Honor, we will do that.
So, siguro that would be all, Mr. Chair, for now. Thank you so much.
Okay, maraming
Thank you so
salamat.
much po, PCSO.
Thank you very much, Kong Montes. And as requested, we request the PCSO to comply, submit sa committee so we can furnish the copy to Congresswoman Montes.
Yes, Mr. Chairman.
Thank you,
We'll do
Chair.
that.
Next, may we call on Representative Faustino Michael D. You have the floor, sir. Please proceed.
Thank you, Mr. Chair, and good afternoon. Good afternoon to our colleagues and PCSO family. Magandang hapon po. Mr. Chair, isang question lang bilang chairman po ng Youth and Sports Committee. The Supreme Court, Giao versus Pagcor and PCSO, GR number 223845-2024, ordered the PCSO to remit to the Philippine Sports Commission the 30% charity fund proceeds of 6 draws per year, including Lotto, for the years 2006 to present. PCSO's own 2025 record shows it remitted only just 1.5 million to the Sports Commission for the entire year. 1.5 cannot possibly be the 30% of the charity fund of 6 draws. 655 draws alone generates hundreds of millions. So for the record, has PCSO fully complied, or this 1.5 million payment is an extent of it? What is the total accumulated amount owed since 2026? I heard it's around 30 billion. Can we have the exact amount? How much has actually been remitted? And on what schedule will the balance be settled?
Para lang po maunawaan natin ang lubusan, ang pinagbasihan po ng PSC when they filed a case against us is yung pong batas na kung saan po ang amin pong i-remit will be based on the old sweepstakes race. Nung yun po ay nawala, amin hong binase yung amin pong dapat na i-remit sa PSC, doon naman po sa 6-digit number, sapagkat pareho po ang mechanics noon. Yun nga lamang po, hindi kasing laki ang naging share ng PSC. So ganun pa man ho, kami ho ay nag-remit na rin ho, alinsunod sa huling desisyon na itinadhana po ng Supreme Court. At yun nga po, actually sa amin pong kwentang ginawa ho, base ho doon sa amin hong sarili interpretasyon, ay meron pa nga po kaming over remittance. In the amount of 45 million. Pero ganun pa man ho ay patuloy po ang aming pakikipag-ugnayan sa PSC. At nang muli naman pong maibalik doon sa dating batas, ay amin po naman ngayon pinagsisikapan na maibalik po yung the old yung sweepstakes race. Nang sa ganun po ay doon po maibalik yung pong tamang remittance na hinihingi po ng PSC sa PCSO.
Yung total amount, meron po kayo? Magkano? Yung since 2006?
The total amount remitted for the year 2006 to 2025 is more or less 73 million. And the total remittance by the PCSO is 122,419,000. So that's the total amount that we already remitted to the PSC.
122 billion? Tama ba yung narinig ko?
122 million.
Million. Sige, parang ang narinig po kasi natin na sa mga 30 billion, kasi dapat 5% ng lotto sales po natin yan, di ba? Under Republic Act 6847.
Yung po yatang 5% is with the PAGCOR.
Okay.
Ang sa amin po ay percentage on a number of races.
Okay.
Yun nga lamang po na wala na po yung sweepstakes race. So ang ginawa ho namin ay a certain percentage on the number of draws dun po sa aming 6-digit games.
Okay. So, nagkamali yata ako, yung 30 billion sa PAGCOR, hindi sa PCS.
Yes, yung pong 5%.
Sige, maraming salamat po. Maraming salamat, Mr. Chair.
Thank you po, Mr. Chairman. Thank you, Your Honor.
Okay, thank you very much, Congressman D. So next, may we call on... Okay. So may we call on Rep. Arrogancia? Lumabas din? Wala na. Ano si ano na? Pajernos. Okay. So next, may we call on Attorney Pajernos? Sir, you have the floor. Please proceed.
Thank you, Mr. Chair. Good afternoon po sa ating PCSO, especially kay Chairman Robles and General Manager. May few questions lang po ko sa ating PCSO. Una po, sa procurement and feasibility of landing craft vessels. Sa inyong fiscal year 2027 strategic trust, nakasaad na mamimigay ang PCSO ng LCVs or landing craft vessels sa mga coastal provinces at municipalities. LCVs are heavy maritime assets na karaniwang binabay at minimaintain ng military at coast guard. Ano po ang legal mandate ng PCSO para mag-procure ng ganitong uri ng naval vessels? Magkano ang total budget allocation para dito po sa 2027? At paano po masisiguro na hindi ito magiging matakaw sa maintenance cost para sa mga makatanggap na LGUs?
Chairman, good afternoon po. As you know, lahat po ng mga bayan po, lalawigan at mga syudad ng ating bayan ay meron na pong ambulansya. At ang iba pong mga bayan ay marami pong isla. No? So ang kanilang mga ambulansya ay hindi rin po makakatawid. So it will be just inside the municipal island or the area nila. So kasama rin po sa aming mandate for providing medical mobility sa aming mandate namin to provide charities of national character, ang gawin pong effective yung pinamigay namin mga ambulances or PTP na tinatawag. And yun po ang nakita namin na very effective way to hindi na po bababa kasi ang pasyente. Kung maalala nyo po, isinasakay pa po mula sa ambulansya, inililipat yan sa si ambulance. So kung maalan po yan, magkakaproblema pa po pag binubuhat yan. So ang aming intention is to have this door-to-door na po, yung ambulansya na po mismo ang isasakay dun at dadali na po sa paglilipatang ospital na mas equipped kung hindi po kaya. No? At meron po kaming, ito naman po ay the LGUs will have to secure licenses po from Marina once they receive this. No? At we are starting with around 10 muna, no, sa procurement namin ito. And then we will proceed from there for the next years naman po ang pagbigay namin. Kasi hindi naman din po lahat. And by the way, this will be for the provincial governments po dahil medyo iba po ang maintenance nito. No? So we will be giving this to the provincial governments for them to schedule kung alin po yung mga bayan nila na mas nangangailangan nito. And then doon po sa aming procurement, we required whoever bidder will win to maintain it for the first 3 years, including the training of the personnel na gagamit po nito.
That's good to hear po, Mr. Chair. On equity and patient transferred vehicle naman po distribution and AI X-ray deployment, nag-report po kasi ang PCSO ng 100% distribution ng patient transport vehicles, 1,675 units na nagkakalaga po ng around 3.73 billion at pamimigay ng 197 million worth of medical equipment tulad nga po nung na-mention ko na AI-capable portable x-rays. Ano po ang criteria ng PCSO sa pagpili ng mga probinsya or ospital na nakatanggap po nito? At tinitiyak ba natin or matitiyak pa po ba ng ating PCSO na ang mga geographically isolated and disadvantaged areas or GIDAs ang nauuna sa pamamigay kumpara sa mga urbanized LGUs na may kakayanan naman bumili ng kanilang ambulansya?
Number one po, we give dun po sa siyempre po siya mas nangangailangan at sila po ang nakakaalam nun, no? Ang mga hospitals ng LGU ang mas nakakaalam ano po ang pinaka-priority pangangailangan nila. Depende po sa kanilang mga personnel na hired to conduct such services and through the equipment na kaya nila. Sapagkat kailangan din po dyan ng radiologist, no? Mga specialization. And the criteria is dapat po they have to show that una-una kailangan nila at they can actually administer the service na binibigay sa nila. And then of course, it is a matter po of kasi pipila din po dito. It's a first come first serve din po sa amin kung sino po ang hingi po ng ganun. So it's a combination of this. If you need them, depende on the priority na kailangan, and then the ability nila to train their personnel, no, to handle such equipment, and then yun na nga po is the order ho ng pagre-request nila.
Thank you, Mr. Chair. Mr. Chair, just wanted to make a quick manifestation. So nakita naman po natin ng nagawang magagandang programa po ng ating PCSO. And with that, everything speaks for itself. Nandito naman po sa kanilang report. I just wanted to make a manifestation of my full support for the proposed budget ng ating PCSO. And hoping that you continue whatever you're doing for the country. And of course, nandito po tayo ang ating House of Representatives to assist in everything that we can in order to help more of our kababayan po. Yun lang po. Maraming salamat po, Mr. Chair.
Yes, thank you very much, Attorney Rurik Pajernos. Next, may we call on Representative Gov. Ramil Hernandez.
Maraming
proceed.
salamat po, Mr. Chair, sa PCSO family headed by GM and Chairman. Wala naman po akong tanong and wala rin po akong reklamo. I just want to congratulate PCSO for a job well done and full support po ang inyong lingkod dito po sa inyong proposed budget for 2027. Again, congratulations po.
So thank you at same as Congressman Ramil Hernandez. Gusto ko lang magpasalamat sa PCSO at of course sa ating magiting na chairman and president, no? Si chairman ay kaibigan natin 'yan, no? So alam ko naman ng napakaganda ng mga naging programa ng PCSO, especially yung mga vehicles, no? Yung mga talagang nakatulong, lalo na sa akin sa lalawigan sa Occidental Mindoro, no? Maraming salamat sa inyo. At we will fully support your budget, no? Kung dapat mag-increase pa, no? So, yun lang. Maraming salamat.
Mr. Chair,
Thank you very much, Kong
Mr. Chair.
Tariela, for your expression of support. May we now, may
may nauna. Sa akin, Mr. Chair, full support tayo sa pag-approve ng budget ng PCSO dahil sa matulong na binabahagi naman tayo sa atin, wala naman tayong tulak kabigin. Importante, katulad nung last meeting natin, sana ay ma-improve lang ng konti yung nabanggit natin during our last meeting. Maraming po salamat.
Thank you very much for another expression of support from Congressman Joseph Tan. Next po, on our list is, may we call on Representative Christy Angeles. Please proceed, ma'am.
Good afternoon to my fellow colleagues at sa ating mga bisita po from PCSO. I would just like to express our gratitude and thanks kasi napakalaki po ng tulong ng PCSO sa 2nd District of Tarlac. We are very appreciative, yung pong lalo na po yung mga karagdagang mga financial assistances pagdating po sa hospitalization and MAIPs. And sometimes kami as congressman, limited lang kami sa guarantee letter na pwede naming ibigay. But because of PCSO, sumasagot sila dun sa mga malalaking halaga na hindi namin kayang ibigay as congressman. So, I fully support the request of budget ng ating PCSO.
Thank you very much, Congresswoman Christy Gonzalez. Christy Angeles, ma'am. Salamat. So, balik po tayo sa minority. May we call on Representative Presley De Jesus. Please proceed, sir.
Thank you, Mr. Chair. And of course, no, sa PCSO, I've been in PAGCOR, DITC, DTI. Nagtanong ako, no? But pagdating sa PCSO, wala ako makitang kumbaga negative comment, puro positive. With all my colleagues here, puro in support. Who am I to say no, no? Especially to my good friend, of course, si GM Robles and my good friend, Judge Felix, chairman na kaibigan ko to 20 years ago eh. So it's a good combination between GM and of course the president, chairman, no? So again, being the deputy minority leader, during the plenary budget, I will not ask question in the plenary kasi we will support you 100% on behalf of the minority. Thank you, Mr. Chair.
Okay. Maraming salamat, Congressman Presley. Next, ang ating colleague, Representative Queenie Gonzalez.
Thank you, Mr. Chair. This is just a quick manifestation lang po. Of course, ang PCSO nasa Mandaluyong po sa aking distrito, and we are very, very thankful for the numerous support they have given. They always give the Mandaleños po. You mentioned lang po GM kasi di ba yung sa patient transport vehicles, it's a blend of first come, first serve po and yung willingness ng LGU. Yung kumbaga very dense yung mga population doon sa city. Siyempre, kailangan po yun sa Mandaluyong, marami ho talagang tao. So, siguro po very parochial lang naman po. Yung amin po kasing mga ambulances, siguro kahit marami, pero 2017 pa po ho yun. That na nabigay sa amin and 2022 pa ho. So, kung meron pong, siguro kung meron po kayong mga up and coming, wag niyo ho sanang kalimutan kung nasa ang distrito po kung nasaan ho kayo nandoon. Yun lang po. Maraming salamat po.
Mr. Chair,
Yes,
plano
please
rin po namin, in as much as the ambulances po ay it's an emergency vehicle. Pag emergency po, hindi ho pwedeng magka-downtime yan. So, one of our next aspiration is to provide the second round sa mga ambulansya po para pag may nagsiraan, meron pa pong backup. And para po sa immediate sa kagyat ng pangangailangan po ng mga taga Mandaluyong, meron po kaming standby ambulance sa aming office. Kung kailangan nyo po, call us po and we can provide you. Yun po. Yun po ang meron ho kami niyan. Pag talagang kailangan nyo, tawagan nyo lang ho.
Ang swerte naman ng Mandaluyong City. Sana all.
Thank you. Thank you, GM. Pero pag meron pa po, please, kasi ang dami po talagang health center po sa amin ngayon na nagmamakaawa po na sira na rin po yung kanila. So kung meron din po, nag-aagawan po kasi GM. So ayun lang po kung meron po.
Mr. Chair, another thing na hindi pa rin na-avail sa amin ng mga taga-Mandaluyong is that we have an outpatient clinic mismong sa office po namin. Kaya kahit po yung mga pasyente ninyo or anybody dito, kung kaya nyo po magpadala sa PCSO, doon po, pati po gamot doon kapag available po sa amin. So libreng konsulta, may kasama pa pong gamot. At kung kailangan nga po ng ambulansya, we'll still provide. Neighbor po namin kayo, hindi nyo po ina-avail.
GM.
Ganun po ba? For that po, GM, I will also announce it in my Facebook dahil marami pa ho palang programa na marahil ay hindi ho alam ng taga sa amin. So maraming salamat po. And we fully support all the programs of PCSO. And again, thank you very much for all the countless support that you are doing in our district. Maraming salamat din po.
Thank you very much, Congresswoman Queenie. Sa lahat ng sinabi ni GM Mel, parang nainggit yung mga ibang congressman dito. Sana all daw at magkaroon din ng ganong services sa iba't ibang distrito. So next, may we call on Congresswoman Inares.
I don't have much to say, but I'd like to say thank you in advance kasi my district hasn't received any of this except for the charity timba. But I would like to thank you for supporting and also helping our governor, our Rizal province naman. We're very much supported by the PCSO, so we're grateful for that. But specifically my office, yeah, don't forget.
Mr. Chair, for the record po, Rizal was the first province that achieved 100% nagkaroon po siya ng patient transport vehicles so ambulances po. Maybe before you came, baka ako dumating doon. But don't worry, magsa-second round pa po kami.
I mean, before I took office, I saw and witnessed how supportive PCSO has been in the entire province, not only in my district. So thank you for that. I appreciate that in our behalf.
Okay, maraming salamat, Congresswoman Mia Inares. Session suspend for 1 minute. is resumed. We are very fortunate this afternoon. Nakahabol po yung ating bising-bising chair. As you know, ngayong budget season, ang dami nangyayari all at the same time. And nakahabol po ang ating chair of the Committee on Appropriations, Chair Mika Swansing. And I would like to recognize her for this afternoon's hearing. I think she has some questions for PCSO. So, Chair Mika?
Thank you very much, SBC. I would like to thank Senior Vice Chair Abet Garcia. Nagde-divide and conquer po kami buong araw because a lot of meetings are running concurrently. So thank you so much, SBC, for managing the PCSO briefing very, very well. Thank you po. I just have one question lang po before we end. This is also the same thought process that I employed earlier when I was looking through the financials of PAGCOR. Kasi po, we are very grateful to PAGCOR and PCSO because you are our partners in, you know, contributing to nation building in terms of the fund. So yun po siguro yung titignan ko lang as to the trajectory or the trend on the contributions of PCSO on special laws, taxes, and dividends. So looking through the slides po, from slide 9 to slide 13, you would see there po the sales from fiscal year 2023 to projected fiscal year 2027. We can see here po that year on year po, the total sales increase. It increases. The trend is it increases every year from 2023 to 2027. 60.4 billion in 2023, 61.3 in 2024, 63.8 in 2025, 65.9 in 2026, and 67.2 in 2027. So tumataas po siya consistently from one year to another. If you would plot it against the grand totals for the taxes, dividends, and other remittances, which is in slide 17 po. You would see what you showed us po would be the grand total for taxes, dividends, and other remittances from 2023 to 2026. So you would see there po, it seems like it's roughly either static at the 22 point, parang nangyari po, nag-plateau siya sa 22.9 billion rather than, and then it went down year on year. So instead po of tumaas siya from one year to another, as is the trend for the sales, parang ang nangyari po, 2023, 22.9 billion po siya, and then it went down from there. So 22.99 in 2023, 22.26 in 2024, 21.85 in 2025, and 11 in the first half of 2026. So I would assume po, we're looking at 21 billion also in 2026. So yun lang po siguro yung tanong ko. I just wanted to plot the numbers, but I just wanted to ask po, Chair, as to why the upward trajectory of the sales revenues from 2023 to 2027 is not consistent with the taxes, dividends, and other remittances na trajectory po. Because ideally, they should go up at the same time. Yun lang po. Thank you po.
Thank you, Madam Chair. And to address your concern, I would like to give the floor to Ms. Joanne of our Accounting and Budget Department.
Thank you. Thank you, Chair. Go ahead, ma'am.
Yes po, good afternoon po. First po, for the taxes po kasi ma'am, if you will see the 2023 taxes from 17 to 16 billion, then to 17 billion po ulit. Mostly po, ang naka-affect po dyan is yung the corporate income tax po. So, di ba po, kapag maliit po yung net income natin, maliit din po yung corporate income tax. Same as affected din po ang dividends po natin dito. So, halos the same po sila. Then, for the other special contributions po, naka-affect actually po yung kay sa UHC wala naman pong problema kasi as sales goes up, yung sa DST is affected. So, ganun pa rin naman po yung magiging computation for the UHC. So, mostly lang po, ang naka-affect lang po dyan is yung taxes and dividends. So, the corporate income tax and yung final income tax, yung tax on winnings po, medyo hindi po din kasi po yun stable kasi depende po yun do sa tax on winnings po namin na more than 20,000, more than 10,000 na 20% po.
Thank you, ma'am. Actually, I noticed din po under this column, Republic Acts and executive orders, medyo downward din po yung trajectory. So that's also a big contributor to the downtrend because in 2023, it's 802 million, then 680 in 2024, then 344 in 2025, tapos tumaas po ulit in 2026. So is there a reason why? Are there particular laws or executive orders enacted around this time period that contributed to that erratic trend in support to special laws?
Yes po, ma'am. Actually, yung nakikita nyo po under mga Republic Acts and EOs, yan po yung sa Girl Scouts, Boy Scouts, which depends po sa sales po ng 6D po natin. So, yun po yung kaninang, then mostly, actually yun, Boy Scouts, and yung isa rin po nakapag-contribute dyan is yung share po natin sa dangerous drugs din po kasi depende po yon dun sa forfeited prices po natin. So kung maliit po yung forfeited prices po natin, maliit din po yung magiging share po nung dangerous drugs po natin.
So just to understand, ma'am, it seems like the trend is erratic given that these are contingent on factors na hindi siya constant year on year. So is that the case that's the case for taxes, that's the case for dividends, that's the case for Republic Acts and executive orders. Yung UHC lang yung medyo constant kasi earmarked talaga yan as per the law. So yun lang po. Kasi tinitignan ko lang kasi ideally po as the sales increase, the contributions also increase. So it's not that big of a discrepancy naman po. But ideally po kasi medyo tumaas po kasi roughly 5 billion yung increase ng sales from 2023 to 2027 year on year. So I was hoping na sana ganun din yung increase in the contributions to government. But now I understand po, it's really because it's contingent on factors that are not within the control of PCSO. But again, nevertheless, I would like to commend PCSO for all the contributions to national government because the funds that you have been contributing as showcased here, roughly 112 billion pesos from 2021 to 2026 really plays a huge role in funding priority government programs and projects. So I just wanted po to scrutinize that, the financials, because that's also the type of scrutiny that I did for the financials of PAGCOR earlier today. So yun lang po. SBC, that's my only question po to the PCSO family. Thank you very much po. Thank you, Chair. Thank you po, GM. Thank you, ma'am, for responding to the query.
Thank you rin po, Madam Chair.
And I would like to say thank you na rin po for being flexible with your time, with the rescheduling, because the hearing of PCSO should have been last Tuesday, but given the suspensions in light of the inclement weather, we had to reschedule it to today. So we'd like to thank the officials po of PCSO for making the time as we rescheduled it to today. Thank you so much po.
Madam Chairperson. Magmumove ako. Madam Chair, I see, Mr. Chair pala. Mr. Chair, may I move that we terminate the budget briefing of the Philippine Charity Sweepstakes Office? I so move.
Do we hear any second? It has been moved and seconded. The motion is carried. Thank you, Your Honors, and to our colleagues from the Philippine Charity Sweepstakes for your valuable participation in today's proceedings. We likewise thank the Chair and the members of the committee for their active participation.
Mr. Chair, I move that we suspend the committee proceedings and resume tomorrow, August 25, 2026 at 9 a.m. I so move.
Second, Mr. Chair.
Any second?
Second, Mr. Chair.
It has been moved and duly seconded. The committee proceedings are hereby suspended at the Romualdez Hall and will resume tomorrow, August 25, 2026 at 9 a.m. Maraming salamat po sa inyong lahat.